Every movement you make, every step, every word, every memory, relies on the intricate wiring of the brain and spinal cord. But when that system is suddenly damaged, life can change in an instant. A stroke occurs when blood flow to part of the brain is blocked or when a vessel ruptures. Most strokes, about 85%, are ischemic, caused by a clot. The remaining 15% are hemorrhagic, where bleeding compresses brain tissue. Imagine a 65-year-old man with hypertension who suddenly develops right-sided weakness and slurred speech. Therapy may help him walk and speak again, but the recovery journey can be long and challenging. A traumatic brain injury, or TBI, is different, caused by an external blow to the head. Falls, car accidents, sports collisions, all can damage brain tissue. A professional athlete with repeated concussions might struggle with memory, mood swings, or concentration, requiring careful, graded rehabilitation to help the brain heal. A spinal cord injury, or SCI, disrupts the communication highway between the brain and body. A complete injury leads to total loss of function below the damage level. An incomplete injury preserves some movement or sensation. A person with a C6 injury from a car crash may move their arms but not their legs, and needs adaptive exercise equipment like upper body ergometers to stay active. Despite their differences, stroke, TBI, and SCI share common challenges: motor impairments like weakness or paralysis, cognitive and emotional changes, loss of independence, and systemic effects including reduced aerobic capacity, muscle atrophy, insulin resistance, and a higher risk of obesity or osteoporosis due to inactivity. Treatment requires an entire team: neurologists, physical therapists, occupational therapists, and exercise specialists working together. Medications help manage spasticity or prevent future strokes, while neurorehabilitation helps restore as much function as possible. Exercise becomes a cornerstone of recovery. Because these patients have lower peak heart rates and reduced efficiency, training must begin gently. Submaximal protocols using treadmills with handrails, cycle ergometers, arm bikes, or wheelchair propulsion tests. Programs often include aerobic exercise 3-5 days a week at 40 to 60% of VO2 peak, resistance training 2-3 days a week using bands or accessible machines, flexibility training to reduce stiffness and prevent contractures, supported or seated activities like recumbent stepping or arm cycling. The benefits are profound: improved walking speed, better balance, increased insulin sensitivity, reduced depression, and stronger cardiovascular health. In one example, stroke survivors improved their walking speed by 30% after 12 weeks of treadmill therapy. When exercise specialists collaborate closely with the medical team and connect patients to community programs, like adaptive sports or aquatic therapy, recovery becomes not just possible, but empowering. With the right support, movement becomes medicine, helping individuals reclaim independence, rebuild confidence, and move toward a life of greater strength and possibility.